Assalamu alaikum. Today's our lecture number is 10 and our topic is anti-allergic drugs. So let's start our lecture. Hypersensitivity. First of all, we should know about hypersensitivity. What is hypersensitivity? Hypersensitivity refers to undesirable reaction produced by the normal immune system, including allergies and autoimmunity. Here is are classified into four types. Type 1 reaction mediated by immunoglobulin E antibodies, and type 2 cytotoxic reaction mediated by immunoglobulin G or immunoglobulin M antibodies, and type 3 reaction mediated by immune complexes, and type 4 delayed reaction mediated by cellular response. Next, here is in time the immune system learns to recognize and remember the allergen, so it start making antibodies to attack it when exposure occur. This build-up is called sensitization. Some allergens are seasonal. For example, hay fever symptoms can peak between April and May. Next is when an allergic reaction occurs, allergen bind to antibodies that the body produces called immunoglobulin E. Production of immunoglobulin E is activated by T helpers, and these molecules then binds to receptor of the surface of mast cell and basophil. Mast cell release histamine and other inflammatory chemicals. Next, when an allergen reaction occurs, when a person's immune system become hypersensitive to certain substances such as food, pollen, and pets, and so on. Next is anaphylaxis, especially common in susceptible individuals in following insect stings, and also called anaphylactic shock. Histamines, this cause the visible symptoms of a localized allergic reaction, including runny nose, watery eyes, constriction of bronchi, and tissue swelling. Next is class of anti-allergic drugs. Antihistamines used to treat allergy symptoms fall into two categories: sedating and non-sedating. And next is decongestants and corticosteroids, leukotriene receptor antagonists, and immunotherapy. Mechanism of action of these anti-allergic drugs. First of all, we will discuss about antihistamine. For example, azelastrine has triple mode of action, and antihistamine effect by blocking histamine, mast cell stabilizing effect by blocking mast cell, and anti-inflammatory effect. Next is quetiapine is antihistamine act like antihistamine effect by blocking H1 receptor and mast cell stabilizing effect. Then the other antihistamines are carbinoxamine, desloratadine, hydroxyzine, and levocetirizine. Here is cephalosporin blocks the action of the cysteine and leukotrienes on the cystyl LTA1 receptor, thus reducing constriction of the airways, build of mucus, lungs, and inflammation of the breathing passages. Next is corticosteroids. What is here is the negative feedback. It is a fundal control of mechanism and producing hormones by interior pituitary. These are LH, for example, luteinizing hormone, follicle stimulating hormone, thyroid stimulating hormone, adrenocorticotrophic hormone, growth hormone, prolactin, etc. Corticosteroids, cortisol is a major glucocorticoid in humans. It has two primary actions. It stimulates glucogenesis, the breakdown of protein and fat to provide metabolites that can be converted to glucose. On the other side, all of these have negative feedback. For example, reaching an adequate plasma concentration of cortisol and corticosteroid inhibits secretion of adrenocorticotropic from the adrenohypophysis. And other corticosteroids are budesonide and fluticasone, mometasone, and triamcinolone, celestodone. These are corticosteroids have serious side effects acting as cortisol, producing by adrenal cortex, adrenal glands, and by acting adrenal corticotropic of pituitary hormone of anterior pituitary. Next is allergen therapy. Allergen immunotherapy, also known as desensitization or hyposensitization, is a medical information for environmental allergies. Here is a prescription of antihistamines includes azithromycin, nasal sprays and eye drops, carbinoxamine, deloxyridine, hydroxyzine, levocetirizine. First of all, azithromycin 0.05 to 5 ml. Internal dose and half-life is 22 hours. Here is the picture of these drugs. Next is OTC antihistamines include cetirizine 10 mg means milligram a tablet. Internal dose and half-life is 8 to 8.3 hours. Next, others fexofenadine and loratadine, ketotifen, and chlorpheniramine. Next is corticosteroids, budesonide 5 ml spray 2 to 3 hours, fluticasone, mometasone, and triamcinolone and celestrodone. Here is the picture of these drugs of corticosteroids. Next is decongestants. Afendreston is internal dose 15 ml nasal spray and half-life is 5.5 to 6 hours. And sulfadrine and sulfadrine internal dose and half-life. Next is leukotriene receptor antagonist and zefalocost and mortalocost. Zefalocost internal dose is tablets 10 mg and 20 mg and half-life is 10 hours. Sorry. And here is the every allergic medications has side effects like older histamines has effect dizziness, constipation, stomach, nasal corticosteroids has can cause headache, nausea, cough. Leukotriene inhibitor cause flu like symptoms, cough, dizziness, and headache, and so on. Nasal decongestants cause sleep problem, blood pressure, loss of appetite. Nasal anticholinergics cause nasal congestants, dry nose, irritating throat, and tropical corticosteroids for skin allergies can cause burning, itching, redness of skin, and thinning of skin, and so on. Here is the way of prescription to a patient. First of all, patient name and address, then prescription and signature and date. Thanks. Allah Hafiz.